This program is brought to you by Community Trust Bank, Medical City, Bid Select, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, a life-lifting news program for women. We're continuing our conversation today with Dr. Kathryn Waldrep with Medical City, Dallas. She's a renowned gynecologist in the Dallas-Fort Worth area, and we're talking about minimally invasive surgery as it relates to procedures with their patients. Dr. Waldrep, we just covered two types of laparoscopic hysterectomies, and now the third acronym, LAH. What is that?
Okay, well, a laparoscopic hysterectomy is where you actually remove the entire uterus laparoscopically. And so when we're talking about laparoscopic hysterectomy, what you do is you would go in through your laparoscope, make that small incision in the umbilicus again.
Which is the belly button.
Which is the belly button, okay? And you put your scope in, and we were talking about at break that the scope actually has a light on it. So that's what illuminates the inside of the abdomen or the pelvis. And then we're doing all this actually looking at a TV monitor. So looking at the monitor, you're freeing up the uterus, and you're freeing it up from the bladder. You can see here's the bladder, and you free it up from the surrounding organs. And there's something that the patients are always a little bit confused about. When we talk about total hysterectomy, a hysterectomy only involves removing the uterus.
What organs are involved within that procedure?
And so that's just the uterus. So there's the uterus and the cervix. Okay. And then the tubes and ovaries are separate. So if we're doing a hysterectomy and oophorectomy, that's a big word, or oophorectomy and salpingo-oophorectomy, salpingo actually refers to the fallopian tubes, and oophorectomy actually refers to the ovaries. So hysterectomy itself is only the uterus. Salpingo-oophorectomy are the fallopian tubes and the ovaries. Okay. So some people say, well, I had a total hysterectomy. And what they're really saying, well, I had a total hysterectomy, and they're saying, well, I had my uterus and ovaries removed. But really, when they're talking about a total hysterectomy, that only refers to their uterus.
Gotcha.
Okay. But anyway, so this is the uterus. And so when we talk about an LAH, that's a laparoscopic hysterectomy that's done totally through the laparoscope. And so you remove the uterus and the cervix, and then you chop it up, and then you close where you removed all that laparoscopically. So you actually sew through the laparoscope and close this, what we would call the vaginal cuff here, laparoscopically. And then you morcellate it and send all that to the pathologist. So instead of closing it vaginally, like we talked about with the laparoscopic assisted,
you do everything from soup to nuts within the laparoscopic procedure.
Exactly.
That's remarkable.
So there's kind of pros and cons both ways, and it's just really surgical preference as much as anything on how you approach it. And then the other types of laparoscopic surgery is sometimes we will just see that a patient has a mass on their ovary. And so we may go in to just remove an ovarian mass or an ovarian cyst. There'll be a cyst on an ovary, and so we'll just go in to remove a cyst off an ovary, or to look and see what's going on in an ovary, like we talked about. And so that might be just an oophorectomy, just to remove one ovary.
Could you define for me what a cyst is versus a fibroid, and what are these masses made of?
Right. A cyst is usually something that's fluid filled, and that's usually on an ovary. Okay? So a cyst is on an ovary, and it's generally a fluid filled structure. A fibroid is made of muscle tissue, and it is actually generally located on the uterus itself. So, and fibroids are 99.9% of the time benign.
What causes the growth of fibroids?
Oh, that's a good question. We don't really know what causes them, but we do know that about 70 to 80% of all women will have fibroid tumors in their uterus, which is part of the reason that so many women end up undergoing hysterectomies or having abnormal uterine bleeding.
Very interesting. Well, it seems obvious to me about what the pros are for minimally invasive surgery. I mean, just a quick recap, you as a surgeon obviously must love this technique. What type of training do surgeons need when this technique technology first came out, and it seems to be evolving and getting better as the years go on.
It does. There's lots of different evolutions that have come about, and there's training that goes on in residency programs for surgeons now, and then we keep going back to more training courses. We have recently started doing some single port surgery, which just means that instead of making multiple little incisions, we're trying to do it all through one incision in the umbilicus. And then robotic surgery is the latest surgery that has come on the market, and there's pros and cons to that as well. The pro is that you've got better visualization, and the robot gives you more ports actually, and it gives you more dexterity because the robot can actually turn.
So the robot, you're kind of like the puppeteer. The surgeon
Exactly.
is moving the robot, and he's actually doing the
surgery
for you. Okay.
And there's more dexterity, so you can actually turn the robot's hands more than you actually can manipulate when you've just got instruments in there.
That's fascinating. Well, Doctor, we're going to take a break here in just a minute. When we come back, I want to wrap this segment with you talking about some of the leading issues that you're seeing with women's health today relative to gynecology, because I know it's an ever-evolving field, and you've been doing it for quite a few years,
Right.
so I'd love to hear that information. Ladies and gentlemen, I'm here with Dr. Kathryn Waldrep with Medical City Dallas, and we'll continue our conversation. I'm Siobhan Palmer with Platforms, the life-lifting news program for women.